Barcelona at the EASD meeting, and we have with us Professor Andrew Boulton, who is one of the founders of the EASD. He's the president-elect of IDF, but for the last 25 years, for almost a silver jubilee, he has been on the executive committee of the EASD, and he has also been very actively involved. He was a president of the EASD for 4 years. So Andrew, how do you see EASD is probably one of the foremost global meetings on diabetes on planet Earth? How have you changed this whole EASD, and how do you look at EASD in the last 20 years?
Well, first of all, you're correct. This is the largest diabetes meeting in the world now, and our record was the meeting in Rome in 2008, which no doubt you remember, with about 18,000 people there. So it is very large. I came onto the board of the EASD back in 1995, and I think the biggest change is we've come from education and running meetings to setting up the foundation, which is now probably the largest giver of grants for diabetes research in Europe. And since we started 10 to 15 years ago, we've given over 100 million euros for research work in basic science and in clinical diabetes and its complications in Europe. So I think that's one of the biggest steps forward. And when I was in charge of postgraduate education, just after the end of the Eastern Bloc, if you like, I was in charge of taking postgraduate education across former Soviet countries and former Warsaw Pact countries, which was very educational for us as well as for the people, hopefully, who received the education. Then I developed the international diabetes or extra-European postgraduate education. As you know, we've had courses in India, in China, Vietnam, South and Central America and elsewhere. So those are some of the developments.
So what is your take from this meeting? Last 2 days you've chaired a couple of sessions. What is your takeaway in this meeting?
I think this is really the first day of the meeting. We had some very good pre-Congress symposia yesterday, and I think we had a really fantastic Claude Bernard lecture today. I'm sure you heard of Stephen Kahn from Seattle, really going into the insulin resistance story and from a personal nature how he's developed that. We're going to have some trials presented here, and I chaired the oral neuropathy sessions today, which were really quite exciting in some of the new areas of looking at the central nervous system, for example, how that's involved in diabetic neuropathy. And there is the Camillo Golgi lecture coming up this afternoon, which one of my former fellows, is Professor Riaz Malik, now in Doha, is presenting on his work in diabetic neuropathy. We have the Rising Stars Symposium. We have the Albert Renaud lecture, which is on more basic science in beta cells and so on. And then we have some other very good sessions coming up over the next 3 days until we finish on Friday afternoon.
So Andrew, you have spent your lifetime in diabetic foot and diabetic neuropathy, and you are one of the founding fathers and one of the foremost experts on planet Earth in diabetic neuropathy, diabetic foot. But still the painful diabetic neuropathy, eludes us. So what are your insights, and what would you like to give Indian people at large living with diabetes? Do you think there's really a hope in the current era? Because you might have very good treatments for diabetes today to control glucose, but when it comes to neuropathy, it's still a challenge.
I think the important thing in neuropathy, again, is prevention and early diagnosis of diabetes. We know that good glycemic control, and not only that, vascular risk factors as well, we've shown in others, are important in the genesis of diabetic neuropathy. So looking after the cholesterol, the blood pressure, equally important. So prevention is best. You're absolutely right. When you have numerous therapies for one condition, you know that the evidence for each one of them is not that great. All drugs have side effects. And the panacea would be to find out a drug that affects the natural history or pathogenesis of neuropathy and also helps the symptoms. That still eludes us. But I think today in some of the presentations we're getting the phenotype of diabetic neuropathy, and it may be with scans and with some nice fMRI studies this morning that there may be a way we can say this patient's got a neuropathy that will respond to drug X. I think that's not far away, but we're still sadly a long way away from a pathogenetic treatment that will not only halt or reverse the condition but also will help symptoms.
Great. What do you think about diabetic foot? In the Western world, the incidence of diabetic foot is coming down. But when you come to still the geographies like where we live in India, we still have challenges. What do you think we should do?
I think, again, it's raising awareness. And as you know, last week I was at what they call the Renal Foot Conclave in Chennai with Vijay Vishwanathan and some excellent local people there. And we helped launch a program for primary care, because primary care looks after most of diabetes in most countries in the world, and yours as well. And we need them to realise from Westerners that you don't need expensive equipment to diagnose the high-risk foot. You need a good ears to hear the history, a good eyes to look at the foot, and simple tools, nothing requiring any expense, not even an electrical power source, that will identify the diabetic patient at risk of foot ulceration. And I think this is the key thing.
Great. So Andrew, thank you so much. And I really must thank Andrew for helping India in a big way. He has been coming to India for the last 2 decades, educating doctors in India, right from the endocrinologist and specialist to primary care. And he's very committed to India, and we are grateful to you. Thank you.
Dhanyavad.